Okay, ready? Next, we're going to go ahead and cover the infraspinatus muscle. The origin of the infraspinatus muscle is along the infraspinous fossa. So it sits along the whole posterior aspect of the shoulder blade here. And then its insertion point is on the greater tubercle of the humerus. So you can see I'm going to go ahead and hit a few different areas in here for trigger points. Its primary function is to externally rotate the shoulder. So to fully stretch it, we're going to be in a position of internal rotation. And when I have the patient actively move for this one. So her elbow is going to stay nice and tight to her side, but her whole shoulder is going to kind of stay relaxed. And then Kristen, I'm going to have you move into internal rotation and external rotation, just like this, kind of moving nice and slow, okay? As she's doing that, I'm going to be working on these different points of the infraspinatus. Go ahead, Kristen. So this is right along the greater tubercle there. Kristen's just moving nice and slow. I use pressure with both of my thumbs here. And I work along the backside of the muscle. One of the most common places I find a trigger point in this muscle is just posterior or backwards of the humeral head here. And then I can even work along other aspects of the muscle here because the muscle is all right in here. I can explore up by the spine of the scapula, right underneath of that. And I can go directly over her shirt. Keep on moving for me, Kristen. But she's a little bit tight right here. You doing okay?
Mm-hmm.
Excellent. And I just kind of explore in this whole area. That way we don't leave any stones unturned when it comes to trigger points in the infraspinatus. I tend to do a double thumb, thumbs right next to each other, and kind of just digging straight into the shoulder with a little bit of pressure leaning into her. And that's how we take care of trigger points in the infraspinatus.